If you've ever felt short of breath, there is a number we use in healthcare to tell if your body is getting enough oxygen. And when the number drops too low, we take it very seriously because it can mean your body is not getting the oxygen it needs. Today, I'm going to explain the oxygen number that sends patients to the ER, what it means and when you should worry. Hi, I'm Fairchild. I'm a registered nurse with over 15 years of experience. On this channel, I explain health topics in a clear and simple way so you can feel more confident about your care. Disclaimer, this video is for general education only. It does not replace medical advice. If you're worried about your breathing or your oxygen level, always contact your doctor or seek medical care. The goal of this video is to help you understand when it may be time to seek medical attention. Because most of the time, people don't realize that you can feel okay and your oxygen level can still be dangerously low. So let's start with the basics. So what is oxygen in the body? Oxygen is something your body cannot live without. Every breath you take brings oxygen into your lungs and then into your blood. That oxygen travels through your body to keep you alive. It helps your brain think clearly, your heart beat strong, your muscles move and work. Without enough oxygen, your body starts to struggle. You may feel tired, confused, short of breath, and if oxygen levels drop too low, your organs can begin to shut down. And that is why in healthcare, we watch your oxygen levels very closely. So how do we check oxygen? Most of the time, oxygen is checked using a small device that clips onto your finger. We call this a pulse oximeter. You may have seen it at a doctor's office or in the hospital. You can also buy smaller versions for home use. If you want a good budget option, look for something like the Zacurate Pro series. It's simple, affordable, and easy to use. You can usually find it on Amazon. Actually, I'll put the link in the description below. This device checks how much oxygen is in your blood. It gives us a number shown as a percentage, and this number tells us how well oxygen is moving through your body. Now here's the question everyone asks. What does the oxygen number mean? The oxygen number tells us how well oxygen is moving through your blood. For most adults, a normal oxygen level is usually 95 to 100%. That means your blood is carrying oxygen well. Numbers like 93% or 94% may be slightly lower and should be watched, especially if you have symptoms. Levels around 90% to 92% are lower, and some people with chronic lung conditions may normally run in this range. But for many people, further assessment may be needed. We always look at symptoms along with the number because pulse oximeter numbers alone do not tell the full story. However, here is the number nurses worry about the most. Anything below 90%. When oxygen drops below 90%, the body may not be getting enough oxygen. This can be dangerous, especially if it stays low. If you see oxygen levels below 90%, you should seek immediate medical attention. In many cases, this means going to the emergency room, especially if you have symptoms like shortness of breath, chest pain, confusion, or feeling very unwell. Do not ignore low oxygen numbers. When you do get a low reading, make sure to try another finger to confirm that your oxygen level is truly low. Side note, sometimes you may get an inaccurate low reading on a pulse oximeter. This can happen if your hands are cold, you're wearing nail polish or fake nails, your fingers are moving during the reading, you have tremors or jitters, or the device is loose. Try to warm your hands, sit still, and make sure the device fits properly. Then check again. If it stays low, take it seriously. As healthcare providers, we always confirm the reading and we never ignore a true low number. Oxygen numbers give us important clues about how the body is working. Low oxygen is not something to ignore. If this video helped you, please like and subscribe and share it with someone who needs to understand their oxygen numbers. Like and subscribe and remember to just ask a nurse.